and welcome to Ask the Chiropractor. I'm Dr. Rodnick, and I'm here with Dr. Toni Rodnick.
It's a pleasure being here. It's such an honor to be with you on this show.
Why, thank you. So we've been practicing in Midland here, a husband and wife team, along with a whole lot of other people in health. We have a whole lot of other chiropractors out there with the same name, last name, and today we're opening up a new, not today, in a couple of days, this Thursday, is another office over our daughter and son-in-law are going to open up over in Troy, Michigan. So we're going to that. It should be fun. We're going to have a blast. And today we're going to talk about several great topics. It's winter out here in Midland land, and we're going to talk about the body's resistance, and we're going to talk about auto accidents, motor vehicle accidents, and snow shoveling. So that's going to be great. But before we start with all of that, we want to do a remembrance here in memory of Jeff Herringshaw, who's been with us. He's done every one of these shows with us, and he's been over 15 years?
More like 25, 30 years.
And he's been with us for at least 30 years. And he was the kind of fellow that would walk into a room, it would brighten just by his presence, and the happiness level would increase and enjoyment level because of his mindset of serving out of his own abundance. And everywhere you went, anyone who met this person, Jeff, was just in awe of his kindness and serving attitude. And he will be absolutely missed, and came to a shock to all of us, and we will miss him.
We loved him, and he was such a great guy.
Yes, a friend, colleague, warrior. Just gonna miss him to pieces, and think of him every day. And I know he's doing really well, and wherever he always did well in anything he ever did. I can't even think of anything he didn't do well. So anything he ever took on was done well. And I'm sure this whole afterlife thing he's doing and rocking it. Anyway, so it's winter out there. It's cold outside. So let's talk about immunity. Let's talk about how the body, first of all, living on this planet, you got about 75 trillion cells. Some people say 70, some say 72. Depends how you calculate it. Trillion cells, all held together by an emanating force, which allows itself to regenerate, allows itself to have homeostasis, which means balance, both in heat, like if you're cold, it makes you have to warm up the body more. If you're hot, it perspires to cool it down, and things like that. So here it is, and the whole body's working, and there's not that much that's involved in that as far as I understand it. So there's only like a few things. Sleep. You don't have any sleep, your resistance goes down. You have to have warmth and keep your body in whatever condition you're in. Exercise, attitude, and maintenance of the spine.
And nutrition. Don't forget nutrition.
The food you eat, the water you drink, the air you breathe. And those are the things that really respond when it comes to resistance to the environment. So the environment consists of just a few things. Again, you got plants, animals, right? You've got bacteria. You've got molds, viruses. There's only a handful of things out there. I mean, each one could be broken down into thousands and millions and billions of different things. But basically, that's it. So you need to sleep right. It's winter time, right? So that makes your body do what in the winter time? It would be
the days are shorter, so our cycle is based on the daylight and times. So we want to sleep more during the winter.
Absolutely. And also the exercise gets decreased sometimes, so we got to exercise more.
Yeah, find something inside that you can do because you can't walk very safely sometimes.
So walking, and I know I've told thousands of people, the mall, you walk around the mall twice, inside I mean, you walk around the mall twice, that's a mile. I actually had one of the patients go out there and measure each tile, not measure each tile, but count each tile, and we multiplied it out, plus a little grout.
I bet you could have just called the mall and asked them how big it was.
I didn't know if they wanted us having people walking there. So then, after that though, now tons of people walk the mall, and I think it's great. I may have started something. I just tell people they got to go exercise. So, also, you want to make sure that your nervous system is intact. So, a strong nervous system. I've noticed that like people have motor vehicle accidents or falls within 2 weeks, 90-some%, it's a high percentage, like 97%, end up with a cold. Simply because
Their nervous system isn't functioning properly. And the nervous system, just like it controls every organ and tissue, it controls your immune system.
absolutely. And so that's what you got to watch out for. And eating right. It's hard to eat right now. You got to go shopping through the snow, walk through the aisleways, which is good exercise, I find. That's probably where I get most of my exercise is walking that thing. So I like to go every day or a couple days to the mall, and I mean to the shopping area. Not for shopping, to get food. And I find that amazing. So what can you do right now to boost your immune system? It's funny how I get little kids in the office, and they get adjusted, and if they have a cold or a fever, I still find that completely amazing. Although I'm starting to get kind of used to it a little bit, but it's still pretty amazing. You know, they'll come in with a high fever, you adjust them, and poof, it's gone. Like within seconds. Seconds.
Yeah, the body has amazing powers when there's no interference.
Yeah, it's incredible. Like in seconds. Hot, normal. Just like that. Like that quick. I mean, it's pretty amazing. So the fever's there to burn up a little bit of the different types of bacteria that's in there. So let's go back into that.
And it also strengthens the immune system. Other immune responses are increased with the increased temperature.
Yes. So, yeah, bacteria is out there trying to live. And what it does, it eats dying and dead tissue. So it could be a tree, a plant. It could be, you know, many different things. So, and there's 3 kinds of bacteria. They have them classified as the ones that like the cold, ones that like the normal temperature, and ones that like the hot temperature. So right now we go back into the cold temperature bacteria, so our body has to build up a resistance to it. And so what it does is when you get a little bit of it, your body will start working and fighting it. And every time it fights it and wins that battle, it builds up an immune system that against that particular bacteria, it can no longer attack again. There is no second, third, fourth of that bacteria attacking the human.
Because we have a memory, the immune system has a memory, and that bacteria will respond just like that if it comes again.
You mean the immune system will, yeah.
Against the bacteria.
Against that bacteria. Yeah, it's an amazing fight. It's like pretty cool. So, and again, that's why we had trouble with taking antibiotics, overusing antibiotics. Not for taking antibiotics, for overusing antibiotics. You really only need an antibiotic, you know, if you get to a certain level on this, A, and B, you want to know which type of antibiotic. You know, you should culture the thing.
And also we use
don't do that. That's
antibiotics for
something we'll do in the
viruses,
future.
and viruses don't respond to antibiotics either.
Correct. Now, what should we do if we get a virus? Oh boy, huh? So, hot water, hot soup, hot, I say tea. I like a little tea, but I don't want to be up all night, so I get the decaf tea. Unless you do want to be up for a while, then
Lots of
fine.
sleep, rest.
Sleep and rest. So what took to get 8 hours is usually 8 hours. Now to get 8 hours, you might need 16 hours or 12 hours or 14 hours. So you got to be, you know, at least aware of that, you know, as far as your sleep time goes. So winter. Motor vehicle accidents.
Wait. Besides strengthening the immune system, we also have to not fight the immune system. The immune system, like you said, the temperature helps the immune system, helps kill the bacteria. The cough helps clear the lungs. But in our busy day and age, when we get tired, we're supposed to sleep. Our body knocks us down so that we'll rest. But in our busy day and age, we look at these as inconveniences, and we try to reduce the fever. We stop the cough. So then the problem gets internalized greater than if we would have let our body respond. This, what we call symptoms in bad, are really a response to help the body to fight what it needs.
Absolutely.
So if we can listen to our body and let it act in a natural way instead of fighting it, we might get over the illness quicker.
So pneumonia is just mucus or snot or boogers, whatever one you want to call, getting in your lungs and staying there. And your body, in order to get rid of it, if it can't cough it out of there, what it does, it sends blood in there. And they have names for that: white hepatization, red hepatization. So first it goes in and tries to kill the bacteria, and then the red blood cells go in there to get rid of it. So that's called pneumonia. And that kills people. So you really want to get that coughed out of there. So how do you cough it out of there? I mean, I understand if you're sleeping, you don't want to cough so much. So at that point, if you're taking something, I mean, prefer not taking anything, but if you need to take something, that would be the time to take it. Then when you get up, you don't want to, decrease your coughing whatsoever or suppressing it. You want to actually increase it. So you want to break up the mucus. So again, the hot stuff, the
steam, like a hot shower,
fluid,
steam room.
And
keeps the lungs moister.
And then if you tip it a 20-degree angle down with your head down and stay there for 20 minutes, then gravity is going to pull that mucus right out of there. So that's how you can avoid some pneumonia. I know a lot of people, the nurses at the hospital used to do that. I don't know if they still do that, or maybe they do. They beat on your back, kind of 20-degree angle facing down, cough that gunk out of there, boom, no more pneumonia. There's no need for pneumonia. Pneumonia is a process, so there's no need for it once that mucus is out of your lungs. You sure don't want dried mucus or dried boogers or dried snot, however you want to look at it, in your lungs, because then your lungs can't get the oxygen, can't breathe, it's coughed. So those dry coughs are very horrible. And if you loosen it up, it does loosen, just like any kind of mucus like that, it loosens up, and then cough that out. I did get an article here that I found interesting. It's the first of its kind, and it was a study published in November 2014, so it's very new, in the Journal of Clinical Chiropractic Pediatrics. It showed that parents of children who had undergone chiropractic care were very satisfied with their child's care. And the study was conducted in England, surveyed parents who brought their infants to chiropractic care for a variety of reasons, like colic, crying, difficulty feeding, and wellness. The authors began by noting that prior to this study, no other study was done to check the satisfaction levels of parents in babies, in infants. So the study was conducted in a teaching facility between 2011 and 13. The infants in the study were between the ages of 1 day and 36 weeks. And in order to be included in the study, the parents were required to fill out a pre and post questionnaires. And there was a total of 395 that were valid. And the first questionnaire was given to the parents before the care was initiated, and the follow-up questionnaire was given after the end of the care. The questionnaires asked the parents to rate their level of distress due to their infant's behavior. At the end of the care, the parents were also asked to rate the degree of improvement of their infant's condition and the satisfaction with the care they received. The results of the study showed a marked reduction in stress reported by the parents when comparing the stress levels before and after chiropractic care, which we hear that all the time. And
well, the baby sleeps better.
Right.
The baby nurses better.
Right.
The baby is less stressful to the parents when it's feeling healthy.
And the ones that acted up, they seem to do a lot less of acting up. You know, you want to call that hypermobility or call it whatever.
Hyperactivity.
There's all kinds of things. The parents reported the infant's sleep improved as well. Prior to the chiropractic care, only 50% had normal sleep, while after the care period, 79% reported that their infants had good sleep, which is huge to a parent. The study reported 75% of the parents were completely satisfied with the care of their infant, the care that they received. And anyway, the parents in the study reported high levels of satisfaction and improvement of the presentation of the condition, of the presenting condition. Parents reported that a decrease in their distress levels and an improvement in the infant's sleep and quality after an episode of care. So that's cool. I wish we would do a lot more studies like this, and I think it's very well done, and we've done a few of those in Michigan. I'd love to see us do more of those, and yep. And I think the government should put it out there, and also I think the United States Army and the armed services should do more studies as well on bringing back, you know, our soldiers and seeing if we can decrease it, because I guess their main three concerns would be stress, backaches, and what was the third one? I don't remember, but chiropractic helps in these arenas.
It does. Chiropractic helps in all those.
Yeah. So auto accidents, motor vehicle accidents. So in the wintertime, for people from the south visiting Michigan, you don't slam on your brakes when you're going down a hill. Okay, moving on from there. You also don't slam on your brakes when you need to stop. You got to kind of figure out when you need to stop. Oh, the light, I don't know when the light's going to change, so I slow down a little bit beforehand. Okay, because you're not going to be able to stop when it snows. That's just the way it is. And going down the hill, hitting your brake, then you can't get up the hill. Now we got to get someone to pick 10 cars and get them all up the hill. Anyway, saw that this weekend, a lot of that. The offices, all 4 offices were just full of people with 2 things: motor vehicle accidents
and shoveling snow,
which will be our last topic, is shoveling snow. So if you even have a 5-mile-an-hour accident and you think you're okay, the problem with that is if you have a whiplash injury where your head, and it's real easy if you're wearing glasses and they're on the floor, obviously you were whiplashed. It's not a question.
Or if they're in the back seat.
Or if they're in the back seat, that's a big whiplash. But even at 5 miles an hour, and I was trying to look up that article this morning, there was a train wreck. It was going 5 miles an hour, and 40% of the people on the train either had broken arms or broken noses. And it was just unbelievable at 5 miles an hour. So we know that it can be devastating to the human structure. And again, we're talking about 75 trillion cells needing to communicate, and it shouldn't be having less nerve supply. So what happens in a whiplash injury, and this person here, Mr. Bones, had a whiplash injury, because the normal curve of the neck should be like this.
A reverse C curve.
This is the head's over this way, the face, and this is the back of the head. But after an accident, it does this. It reverses, okay, or straightens or reverses. Now, in the reverse position, and I think I have a pretty good, you know what, I'm going to use this one over here. I brought this chart specifically for this one. So here's what happens when the neck gets reversed. It starts to tear things here. And then when it goes backwards, it's tearing all of this on the other side. So here on the bones of the cervical spine, there's ligaments going on both sides of this thing. And they tear on both ends. I just recently tore mine up 3.5 years ago. Mine's looking good now, by the way. I'm all healed back up. This can heal. You do not want it healing, though, in the wrong position. So if it heals with the curve going the wrong way, then it's going to deteriorate at a faster rate. Because in this position, your body, just like a tire misaligned in the car, will wear out a whole lot faster. And what it'll do, it'll increase the rate of degeneration by like 6 times, 4 times the normal rate. So 4 to 6 times. This is like 6 times. And what happens is in 10 years, you have a 60-year-old neck. In 20 years, you have a 120-year-old neck. The body was made to be about 120 years old. That's what they've discovered.
And coming out between the vertebrae, the space between the vertebrae, there's a hole formed by the top vertebrae and the bottom vertebrae, and that's where the nerves come out from the spinal cord to go to every tissue and organ. And then when it's degenerating, the disc is getting thinner, so then the hole is formed by the space, and then it's getting closer and closer. So the nerves are being impinged on, and you start experiencing symptoms. Besides the degeneration, besides the soft tissue injury, the ligaments that are sore and swollen, you start pressing on the nerves, and that can cause devastating effects on the body.
Absolutely. Absolutely. And that's the big harm that's in there. Again, if the nervous system wasn't coming from the brain down the cord, then it wouldn't matter. But since it does, that's why it's significant.
And also when the disc degenerates, it can actually bulge and put pressure right on the spinal cord itself.
I had that. That's terrible.
What kind of symptoms did you have when that happened?
Well, my arms and shoulders and fingers, I was having all kinds of twitching.
So it was probably mid C5, C4,
Yes.
C5 area.
Yes, yes. And it was causing, like, my shoulder would start fluttering, and I actually had some of that in the extremities of my legs too. It would just move, weakness, pain, and totally sucked, and didn't like it.
You had a functional MRI where you were taking pictures when you were like flexing your neck and extending your neck.
I did do
what
that.
did that show?
That showed not good.
When you were flexing your neck, what happened?
It was hitting the cord.
And so then what happened when you were bent your neck forward?
If I would bend forward, and I would also bend at the waist. If I would bend at the waist and then look down, I'd kind of go into a seizure effect. Like everything would start twitching and like that, and yikes. Yeah, that wasn't fun. So in other words, the way the spinal cord comes down, when I would bend over, it was tightening up that cord. And then when I bend my neck down, it was hitting. Oh my God. So,
and when you hit the cord up in the cervical area, it can affect anything that goes below that area.
It wasn't good. Wasn't good. But now I'm back, and I'm working 6 days a week again. And
your discs look a whole lot better.
Yes,
they were degenerated. They were
all back.
Dehydrated, and now they're fluffy and.
So your body can rebuild itself. Is the bottom line there? Does it come easy? Is there a lot of leeway not to screw up? No, you got to really work at it. That was chiropractic care, exercise, nutrition, real heavy duty. And a lot of work went into that. I was also seeing acupuncture, a naturopath, an orthopedic surgeon, physical therapist. I pretty much hit the arena head on everybody, and I was all in.
And it worked for you.
But yeah, I didn't have to have surgery. In the beginning, it looked like surgery was the only way. But once again, woo! Thank God I didn't need to do that. Not that it's not necessary in other cases, but
again, the body has amazing recuperative abilities if it's left without interference and with the proper ingredients for health, nutrition and sleep.
And exercise,
and
too.
Exercise.
That was a biggie. Exercise. Because at the age of 25, there's no blood supply to these discs anymore. And if you're not moving, you're not growing anything.
Yeah, because the way the discs get nutrients and take waste out is through motion, imbication.
Imbication, big word. So motion and
motion.
Yeah, without that, I had to keep all the ingredients in there. When you're baking a cake, it needs eggs and flour and milk, and I don't really know how to make a cake, but it needs all these different sugar, and it needs all these ingredients. And so, in order to regrow a cake, you're going to need all the ingredients. So that's what I was doing. And then you need time, because sometimes it's not instantaneous. And I was very happy after about 2.5 years the X-ray actually showed all my
And
discs grew
that's
back.
what's lacking in our society. We're too impatient. We don't have the time to wait for things. We want instant results.
Yeah. Well, instant results would have been having the surgery, but I was talking to the surgeon. He says, yeah, I asked him, how am I going to be when this is over with? And he said, terrible. I said, that's not good. You know, anyway, let's get back to this. But you can see how there's a lot of ligaments in here and tendons. And here's just a blow up of that. So remember I was talking about, it's these bones, you know, taking these bones and just blowing them up, you know, enlarging them. So you see 3 bones here of the cervical area. And there's the ligament.
The anterior
coming down.
longitudinal ligament.
Yes. And then there's another ligament inside
The
here.
posterior longitudinal ligament.
And then there's ligaments in between. You could say interspinatus ligament.
Yeah, and there's
She knows all the names of all of it, which is good, which I do too, but not as good as her. So, and here, this was a ligamentum nuchae gets torn. So by these ligaments being like they are, the formation of the spine, its normal C-shaped curve gets lost in this incident. And
a lot of times it happens at C4, C5, C6,
yes.
that region, and that's where there's a lot of stress, and that goes down into the arms. It also goes to the diaphragm. So
3, 4, and 5 keeps
keep the diaphragm alive.
And yeah, those go into the shoulders, arms, hands, fingers, and so this all needs to be corrected. Now, looking at, let's see if we can get a picture of this other chart here. And would you describe the near normal, if you could, Toni?
On the first picture, it shows the near normal curve. You see the reverse C-shaped curve. You're looking at the shape of the vertebrae. They're all rectangular. There's not a lot of pointy extensions. Bone goes to areas of stress. So if there's unaligned, the body might try to stabilize it by putting on extra spurs. The disc space, you can't see discs, but you can see the space between the vertebrae. I can't reach it quite on this
On
one.
X-ray.
I don't know if I'm on or not. So you see the disc space are nice, space between the vertebrae. And then here, in this one, the curve is gone. It's straight. It's actually a little bit reversed. And so you start seeing, here you see that the shapes of the bodies are not rectangular anymore. There's some spine, there's some spurs growing. The space between the discs is decreasing. As you go along, it starts degenerating. The disc space is really decreasing. There's some spurs. And then as you go along, the growths are more. And so if you can stop it, if you can get the curve back, get the normal functioning, you can prevent it from getting to this point where it's all fusing. The disc space, you can't even see the disc space. There's no motion in the neck. The body has just stabilized it, and it's just a mess. You can see on the diagram there's like a reverse curve. And it's just no motion, a lot of nerves being impinged.
Yikers, huh?
Yeah,
Okay.
ouchers. I look at that
So
and say, ouch.
let's look at this poster over here. You see how the brain is connecting up to the spinal cord? It's all one unit, really. And it kind of comes all the way down. And then out in between each vertebra, there's a hole that she was talking about earlier where the nerves just exit out. And they go to every single cell in your body. And again, it's 75 trillion cells all held together by this emanating force coming from the brain down the cord out to every single cell in your body. So if we reverse this curve and we put pressure on these nerves, it affects the way we think, it affects how we do things, and it affects how much energy we have, and it affects your ability to lift objects and you know, the motor function, how far you can walk, and it just totally, you know, affects all these different things. And now, in Michigan, your auto companies, your auto insurances, they're responsible to cover you for how you were before the accident to how you were after the accident. In other words, if you came in and you had low back pain to start with, and different things with that, and then you had the accident and now you're 10 times worse, they'll cover and pay for it up until you get back to your regular low back pain.
Pre-accident condition.
Pre-accident condition. Same thing with the neck and the shoulder, whatever. It's pre-accident condition. That's what they're responsible for. So, and again, they cover very well. Our state is one of the best states, I think, with the system we have. I really like it. They also have in there, you can't sue for pain and suffering unless you're less than 50%
At fault.
at fault. So if you're at fault, you can't get pain and suffering. So that eliminated quite a bit of the lawsuits that we used to have. And so I think it's getting better and better personally. So the worse you are, obviously before the accident, sometimes the longer it takes. And remember this, muscles and tendons, I was just asked, one of the insurance companies called one of my patients, like, usually muscles heal in 2 weeks, tendons heal in 4 to 6 weeks, and ligaments take months and months. So you have to remember that when you move these vertebrae out of place, you're dealing with ligaments. The discs are made of ligaments, and it takes a lot longer to heal. So when you're looking at your poster that you were just showing, phase 1 can take 6 months to a year and a half. So I've been asked, how long does it take? That's about it. When you've had a motor vehicle accident, it's going to take 6 months to a year and a half generally, unless you're in phase 2. Then it takes a year and a half to 2.5 years.
It depends how long you've had it, because if the ligaments and tendons have healed in the wrong position,
correct.
It's like braces. You got to move it slow, because the ligaments and tendons are going to keep pulling it out.
And if you can't get that correction before the muscles heal, then it takes longer again.
You're right.
So here you are, you whiplash it, and it's going to take months to get that back, and it takes 2 weeks for the muscle to heal, so the muscles again heal, and that way when I'm adjusting, it kind of like pulls it back out of place.
Because the muscles have healed in the wrong position.
Right. So it takes longer yet. It's like you got to break that whole phenomenon. So we use traction helps. Not the kind of traction just to lift up, but the kind of traction to bring your neck back into.
Because a lot of times the curve is lost.
Right. Bring that curve back in. And traction to pump the discs. And traction to, anyway.
And traction to motion.
And
bring
massage
motion to
and all kinds of different things
discs
that we have to do along with it. So it's a lot more involved in a whiplash compared to, just vacuuming and hurting yourself. That usually heals a lot quicker, easier, much easier than these whiplash motor vehicle accidents. And so anybody, like I know in Michigan, it's somewhere between 50 and 60,000 deer accidents alone. So all those people should see a chiropractor. Then you have just every time it snows, 1 million car accidents. Getting, thrown off the road, your car spinning, hitting the rear, hitting the front, hitting the side. All those are whiplash injuries, and they all should be seen by a chiropractor. We love when everyone comes to us, but any chiropractor, it doesn't matter, is what I'm saying. It should be whoever you know or whoever you go to, and they should know how to take care of this too. Not all chiropractors know how to take care of this. So that's another thing. Do they handle whiplash injuries is the question. And if they do, that's great. And if they don't, definitely go see someone who does. Very simple. Some people don't take care of children. So if they don't take care of children, see someone who does. Some people don't take care of the elderly. Some chiropractors don't take care of the elderly. I'm not one of them. So then you want to go see someone who does take care of the elderly. Just like anything, like when you see your medical doctor, if they treat this or that, some do and some don't.
There's so many different techniques. If you're not happy with one chiropractor and not getting results, you can try a different technique or a different doctor.
Correct. I know there's about 200 different techniques I like to use, and it seems like I'm about 197 of them I use. I'm still working on the last 3 yet, but I've got time now that I'm no longer totally disabled. Anyway, it's great to get back to work. So our next topic is going to be snow shoveling, which I know you're an expert at. Tell us a lot about snow shoveling.
Well, I know yesterday we had a lot of patients come in, and they were saying they were sore. And I said, what happened? And they said, well, we were shoveling snow. So I was thinking, I asked a lot of people aren't using proper ergonomic techniques to shovel snow. There's different kinds of snow. The wet, heavy snow is heavy. And when you're using a shovel, you're extending your reach. It's like force times the distance is increased. So you're putting a lot more stress on your low back. And then if you're bending and shoveling and lifting, it's putting a whole lot of force on the low back discs, and it can injure the disc.
Explain that in more details. Give me an example.
Well, in physics, they say force times distance equals force times distance. So take a teeter-totter or seesaw, for example. You can have a little tiny person against a big person. If the big person is close to the fulcrum, close to the point where you're changing direction, and the little person is way far out, this little person can lift the big person, because the force, the weight of the person times the distance, equals the force, the weight of the person times the distance. So if the heavy snow is way out on the shovel, first we're bending. So we got the fulcrum is our low back. We got the length of our body plus the length of the shovel. So it's at least 10 times the weight of the snow is on the low back. The longer the shovel, the more weight, the more stress on the low back.
So a long shovel lifting can
But a long
multiply.
shovel just pushing it would be better.
You could push all day
You
long.
can push all day long, but you don't want to be bending and pushing. You don't want to be bending and lifting. You don't want to be twisting and bending.
So
or twisting
let's go over this
and lifting.
again. I know the distance when holding in just in your hand multiplies it by 10.
That's why they say you want to hold things close up to your body when you're teaching ergonomics of lifting things.
So if reaching out just this far multiplies it by 10, the arm length.
Oh, it's the arm length plus the body length to the low back.
Okay. So what is that? Like 8 feet, 6 feet?
Or less.
And then
maybe,
you have
yeah.
a 6-foot shovel. Would that double or triple it?
It sure would.
Okay. So you got 10 pounds on the other end. It's 10 times this distance.
Which is 100 pounds or 200 pounds of force on your low back
300 pounds
from
on
10
your low
pounds of
back.
snow on the shovel.
From a 10-pound shovel. Okay, so smaller shovelings.
Smaller shovelings.
Okay.
And not bending and lifting.
Because that weight is very significant. It's worth noting there was a bunch of guys digging, and they were digging in the clay, and the clay got wet, so it was wet clay. And it was something like 70% of them all had fractures.
In their cervical area,
In
the
their
thoracic
cervical.
up top. Clay shoveler's fracture.
And they call it clay shoveler's fracture. From these guys were they loggers or something? They were digging clay, and then it rained, and then they all ended up fracturing the spinuses right off their spine. I mean, that's not a real dangerous fracture, but it's inconvenient, at least, right? So that can actually happen when shoveling snow, especially that wet snow. So it starts to melt. When it's light and fluffy, again, they make some of these shovels are huge. They're like this wide.
Some of them now have a bend in it so that it's easier to be ergonomically correct and push it
So
without bending. You can have proper body mechanics.
And also when you go to lift that, you're standing straighter.
Yeah.
You don't have to bend all the way down. So that's good too. So just think smart.
Would it be smart to wear like a lumbar brace
Back
to support
brace. I was
when
just thinking the same thing as you were. Absolutely, I would.
Whenever you do heavy work and you want to keep your back supported.
Well, I mean, is it a good idea to have a back brace when you're, weightlifting?
Yes.
There you go.
They have special braces
So if you're
for
going to
it,
do
special
weightlifting
belts.
outside with snow and a shovel, why not, right?
Yeah.
This is my back brace, and also keep you a little warmer. Serves two purposes, right? And anyway.
Speaking of warmth, so you want to dress in layers so that you stay warm, and you want to use a scarf if it's really bitter cold out, because you don't want to be breathing in the freezing
Cold air.
You want to warm it up.
And what about, speaking of warm-ups, you think maybe if we did, something we do in high school when we go out to do a major physical
Warm
activity.
up the muscles.
Yes.
Yeah.
This is a major physical activity, snow shoveling. And a lot of people are not warming up whatsoever. Then they hit the cold, and then they're just going at it brutally, and that's how they're getting hurt. I mean, probably, they should do a study just on how many people really go to the chiropractor after the first a good snowfall. It's like, it was like half the people.
Yeah, they were all sore from the snow.
It's like a significant amount of people.
People you wouldn't expect to be shoveling snow.
Little old people.
Yeah.
Yeah, it's pretty funny. 85-year-old person comes in, yeah, I was out shoveling the snow. Yeah, how big? Well, the lot's probably a giant parking lot. Like, why don't you get someone to do that? I like doing it. You like being crippled too. But, it's a good activity if it's done right. You really need to, again, body mechanics, warming up. The first thing, again, warming up, and then the body mechanics is too. And again, pushing the snow out of the way is great. And then use a smaller shovel when getting rid of a pile. Like if you have to get rid of a pile, use a. You don't want to lift that much snow, that heavy snow. Simple as that. We absolutely don't want to do that. What other winter things would you recommend? Like, I'm wearing tennis shoes. Nobody wanted to see that, and I wasn't supposed to announce it. But I wore my tennis shoes today. Why? Because they look stylish. And B,
they stop you from slipping.
I don't want to fall in the snow. I hate falling. So these falls, a lot of people fall right now in the slippery and the icy and all that. Oh, my God. It's terrible.
And it's as easy as changing your shoes.
I'm wearing, yeah.
Instead of style, worry about comfort and safety.
Yeah, it's funny. People say, you can always tell a guy by his shoes. Well, I'm wearing tennis shoes. But anyway, I have nice, expensive shoes, but I'm not going to wear them in this weather because I don't want to fall. And anyway, yeah, I've got boots, and I've got, right now in my car, I have my fancy shoes. I got my boots, and I guess I could have changed them when I got in here.
And that's what I did. I actually wore gym shoes outside in the snow too, and changed my shoes.
And a lot of people don't realize that. They want to be fancy. Leather soles
are stylish.
Snow.
They're very stylish, but
man, is it slippery stuff.
Not made for the snow.
Well, we're just going to wrap up this show here. Is there any last things you want to say?
Better to prevent the injury than to heal it afterwards. Be cautious, be aware of your surroundings, be aware of the risks and dangers, and stay healthy and look after yourself.
Very nicely said, Dr. Toni Rodnick. I just like to say my usual. God gave you the gift of life, and what you do with that life is your gift back to God. And again, I'd like to mention in memorial to Jeff Herringshaw, a very loving, caring person. Can't say enough good things about the guy. I just really have only but good things to say about him, and he will be missed terribly.
He will be.
And with that, we'll see you again at Ask the Chiropractor. Right now, we're going to go through some of our exercises. And one exercise I want to talk about that helped me a lot was, and it was given to me by a physical therapist in Traverse City, she was so great. And her husband as well, who made me do it multiple times while I was there, is this. I got the curve back by going like this. And again, I had really torn and ripped up and shredded my neck. And the discs were squashed and the ligaments were laying flaccid or loose back into the cord. So doing this, up and back, and getting the neck that was over here back up there, which that part I knew about, and I had other exercises for it, but that probably That's like one of my favorite ones now.
Now you notice he's just pulling his neck back. A lot of people, when you tell them to do that, they tip their head back. You don't want to tip, you want to just pull the neck back.
Yes.
You're working the muscles in the back of the neck.
Straight back and up. Back and up. And you have many alternatives, which you could get into in a minute.
Yeah.
We're going to let you go for it, Dr. Tone. And we'll see you again next month at Ask the Chiropractor.
Thank you.
All right.
Welcome back to Ask the Chiropractor. We're going to go over some posture exercises. In this day and age, we're always hunched over the computer or we're looking down texting. So when we do that, we're tightening the muscles in front and we're stretching the muscles in back and weakening it. Our posture is bad. We were just talking about why it's important to have curves in the neck so you're not degenerating, not putting abnormal stresses on your body, not pinching nerves. So we're going to do some posture exercises that help counteract some of the positions we get ourselves into. The first one we call the eagle. You want to stand feet shoulder width apart. You want to have your hands down, take a deep breath, and as you breathe in, stretch way up, tip your head back, and stretch up. Hold it, and then breathe out. You want to do this 2 or 3 times. You're going to do this posture pod of exercises 2 or 3 times a day. It's also called spinal hygiene, so a good time to do it is when you think of your dental hygiene. So you want to just stretch. The second one, again, your feet are shoulder width apart, focusing on the core. Your arms are up, and you want to make backward circles with your shoulders. When you're doing this, you want to be focusing on the space between your shoulder blades. You want to be tightening those muscles. And then a variant of this is you can tip to the side. And we always say everything has to be symmetrical, so if you tip to one side, tip to the other side. And just backward circles, tightening the space between your shoulder blades. The third one is called the hummingbird. And you want to clasp your hands and put it behind your head. This is kind of like the exercise Dr. Rodnick was just showing us, where he pushes his head back. But we're going to use resistance on our hands. You're not pushing forward with your hands. You're not tipping your head up. You're pushing right back. Take a deep breath. And as you breathe in, push back with your head. And then breathe out as you relax. Take a deep breath. Breathe in. Pushing back with your head. And relax. So those are the posture pod exercises. We want to do them 2 to 3 times a day, 2 to 3 times on each movement. Thank you, and goodbye from Ask the Chiropractor. It's been a pleasure.